Vermilion-Lloydminster.
Mr. Speaker, last week the Auditor General released his report on health care in Alberta. Now, in it, he describes a fragmented system lacking integration of professionals and a lack of sharing of and use of clinical information. Now, the Health Minister will tell us that all of this is the fault of the previous government. No. Fine. You've been Health Minister for over 2 years. What evidence can you provide that you are making the quantum leap to take the system to the next level?
Here, here. The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and to the member for taking some responsibility for the system we inherited. We are certainly pleased to move forward with a number of recommendations to make Alberta's healthcare system better. One of the very first things we did to enable an environment where we could stop and do that was stop drastic and rash ideological cuts, and that's one of the reasons why we are keen to have a system that has the stability so that we can actually work with our frontline providers, including the physicians, to be able to come up with a new amending agreement that will save up to $500 million in just 2 years, as well as bring forward a blended capitation model that will provide better health outcomes to Albertans as well, Mr. Speaker.
Well, Mr. Speaker, the initiatives that the minister has described fall clearly into the category of incremental change, reorganization, and moving in circles. There's no quantum leap in sight here. And given that the Health Minister also has 41 outstanding recommendations from the Auditor General, and given that there has been painfully little progress on these recommendations during her tenure to the minister, you haven't acted on the 41 outstanding recommendations from the Auditor General. Why should Albertans have any faith that you will act on the outstanding report that he filed last week?
Oh, yeah. Honourable Minister.
Again, I want to thank the Auditor General for his report and his recommendations in past. Many of them have been in place since the 1990s, and while absolutely we are keen to moving forward with improvements to the healthcare system, what we aren't going to do is move forward with what those folks in the opposition campaigned for in the last election, which was $1 billion worth of healthcare cuts. Instead, we're working with frontline providers, including physicians, to find ways to return $500 million to the system so that we can invest that in improvements, Mr. Speaker. And I am very pleased that the Auditor General sees a great deal of opportunities for us to continue to move forward, protecting and enhancing public health care, Mr. Speaker, because that's exactly what this government's going to do.
Well, Mr. Speaker, the minister just did it again. She constantly equates health spending reduction that are proposed by the opposition members to cuts in frontline services. But given that the Auditor General has clearly stated that more money is not the solution, and that given that both this minister and her predecessors of the previous government failed in keeping expenditure increases under the combined inflation and population growth to the minister, the Auditor General has clearly indicated that expenditures and performance are not correlated. When will you stop equating spending cuts or increases to deterioration or improvement of health care performance?
The Honourable Minister of Health.
Mr. Speaker, that is so rich coming from the members of the opposition, who regularly saw increases in excess of 6%, Mr. Speaker. And what did we have to show for it? A blooming wait list. We had deferred maintenance, Mr. Speaker, throughout the province. And what we're doing instead is working as a province. We've gotten our increases down to about 3.5% increases, Mr. Speaker, as opposed to the 6 from the members opposite. And we're doing it with Albertans while protecting public health care instead of pushing for $1 billion worth of cuts, as they had in their last election platform, and now they're asking us to make even more. I think the last number was $3 billion from operations, Mr. Speaker. Give me a break.